You're joining me today at Countryside Veterinary Clinic. With me as your veterinarian, Skylar Denial. Today we're going to be injecting an 1,100-pound horse, Elmo, with the drug Banamine. This horse is, as I said, needs to be injected intravenously, which will be into its jugular vein. For this horse, we need 11 milliliters of this drug because this drug, Banamine, is 1 milliliter per 100 pounds. So he'll be needing 11 milliliters. And to let the other veterinaries know this, we have a little label that we have the drug name, the drug dosage, date, patient name, and veterinary initials on. And we'll be putting this label on the back of our syringe, or the distal side of our syringe. And it goes right there, and you make sure it doesn't cover any of the numbers. And before we start getting our drug into our syringe, we need to sanitize the vial so it's not contaminated, because as you can see, this vial has been previously used. To do that, we need to have our alcohol and cotton ball. The alcohol will go on the cotton ball, and you can be a bit liberal with this use. As you see, my cotton ball is thoroughly drenched, and you'll be rubbing this on the rubber topper of your vial. Now that our vial has been sanitized, we're ready to begin putting the drug into our syringe. To do this, we will take the cap off of our needle, which is an 18 gauge by 1 inch needle. Carefully do that, and then flip your vial over, and then you put the needle inside the vial and carefully extract 11 milliliters of this drug. And now that you can see we have 11 milliliters, we'll tap the outside to get rid of some of the air bubbles. And now this drug, which is labeled and properly filled, is ready to be used on Elmo, our 1,100-pound horse. And this drug, as I said, will be entered intravenously into his jugular vein. Thank you for joining me at Countryside Veterinary Clinic. Thank you for joining us at Hoxie Countryside Veterinary Clinic. Today we're with our patient Ladybug, who will be getting her bandage off. To take off her bandage, we'll be cutting from the proximal end to the distal end. And we'll take our scissors, which are bandage scissors, put the scissors between her bandage layers, and cut the layers, moving down the bandage from the proximal end to the distal end. And peeling the layers away as you go. When you've gotten to the end of your bandage, swiftly take it off the patient. Now, our dog, Ladybug, is ready to go back, so we'll take her off the table. After we've informed the veterinarian that our bandage is off, we'll tell them, "Doctor, the bandage is off." So they'll tell us to clean up the station, obviously. And to do that, we'll just take the dog off the table. And she will stand over here. And to clean the rest of your station, hold on. She would go back in the kennels, which are over here. And we're actually taking her to the kennel runs. She'll go in her run. Come on. Come on, baby. Take their leash off. And now to clean the rest of your station, we'll need to go back inside. And of course, we'll throw away the bandages that we used. We'll put our bandage scissors away for cleaning. And to finalize the cleaning process, you're going to take your sanitation fluid and some paper towels, sanitize the table, and then just use the towels to get off any bacteria or fur that was left by the patient. Thank you for joining me to learn about bandage removal with our dog, Ladybug.